Hi everyone. We have a couple of pieces of information that we want to share with you about holding ET tubes during retaping.
And these reminders are especially important for our extremely small patients, those less than a kilo, but we should be using them for all size patients.
So what we're going to demonstrate right now is our standardized approach to holding ET tubes. We know there are a couple of different ways to do it, but as a team, we wanted to identify the safest way, and so we are going to share that, and then that will be our standardized approach moving forward. So let's get started. Okay, so we are going to demonstrate our new way of holding, but first we wanted to show you a couple of reasons why we do not want to use just a finger inside of the mouth to hold. So reason number one is if I'm holding my ET tube here with the finger inside the baby's mouth, the baby could have a lot of secretions. That tube is going to slide in and out because the only thing that's really holding it is my gloved finger, and if you think about the roof of their mouth, that's slippery as well. So I would worry about dislodgement that way. The second reason why we want to avoid holding an ET tube like this, especially in a baby of this size where your tube might be secured at the 4.75 or the 5, is if I am pushing this up against the roof of their mouth, that's actually going to put upward tension on the back of the tube and could potentially dislodge your ET tube that way. So our preferred way of holding any ET tube when we're retaping is going to be the pinch method. So I'm going to take my two fingers here and I'm going to gently pinch the ET tube right at the baby's gum line. And you can either kind of brace your hand gently on the baby themselves or use your other fingers to kind of brace against their cheek here. So if I'm holding it nice and secure, Nicole can go ahead and retape our patient. Here are a few close-up photos of the pinch holding technique for you to see.
Okay, so I'm going to take this tape off, and when I'm pulling the tape, I want to pull down towards the baby. That creates tension towards the patient, and it'll help keep your ET tube in place, versus if I come up like this, I'm pulling outward tension on that tube and could potentially dislodge it. The other thing that I want to do is once I am free of the tape with the neo bar, I want to let my partner know that I'm free. So Megan, you have control of the tube now.
Love that.
And then I will replace that tape on the neo bar. Just as a reminder, you do have to replace the tape every time that we are adjusting an ET tube using a neo bar if your neo bar is not due to be replaced, and that's because of this tape. It doesn't stay sticky for very long, so we always want to make sure that it has good adherence to the neo bar. And remember, you want to go at least once around your platform with tape before you put your ET tube on there. So then I'm going to put my ET tube up against that platform and then get at least one loop around, and we'll double check where we're at.
Okay, we are at the 5 at the gum line, which is where we should be.
Okay, and then we are going to go at least 2 times with tape around the ET tube to secure it. And then at the very end, you just want to leave a little tab of tape so that for your friend who has to retape them next time, it's easy to get that tape off.
Perfect. Please let an educator know if you have any questions.